Hello guys, welcome to my YouTube channel, The Medic Man. Today we are going to see the various diseases of the heart and also the common anatomy and physiology of the heart and also how the IHD progresses. So, the human heart is remarkably efficient, durable, and reliable pump, distributing more than 6,000 liters of blood throughout the body each day and beating about 30 to 40 million times per year. So you can imagine how the bulky activity of the heart carry on. Then after that, we are going to see CAD and myocardial infarction. So let's progress. Our heart. Our heart varies with body habits and approximately weighing about 0.4 to 0.5% of body weight. There are total three layers of the heart: the epicardium, the myocardium, and the endocardium. But the bulk of the heart, the bulk of the heart is made up of myocardium. Myocardium does the pumping action of the blood, that is, systole and diastole of cardiac myocytes. Valves. There are total four valves present in the heart: the tricuspid valve, bicuspid, pulmonary valve, and the aortic valve. These all the four valves are lined by the endothelium and share a similar tri-layered structure. Tri-layer structure is of three types of layer. First is the dense collagenous core, which is known as the fibrosa. The central one, which is the loose core, is known as the sponchiosa, and the last is rich layer of elastin. Pathologically, changes of the valve is of three types: that it can damage the collagen, which weakens the leaflets, and thereafter the murmur sound of the heart is heard. Then there is a calcified arterial stenosis, which can be seen in Lay's disease, and fibrotic thickening, key feature of rheumatic heart diseases. Then the conduction system of the heart. The conduction system of heart comprises of four different types of pacemaker. First is the SA node, second is the AV node, third is bundle of His, and last is the Purkinje fibers. So the impulse travels from SA node to AV node, then from AV node to bundle of His, and from bundle of His to the left and right bundle branch, and from that to the lastly to the Purkinje fibers. Here the it will help the heart to relax and contract simultaneously. Then after that, the blood supply of the heart. Here we can see that the blood anteriorly the blood is supplied by the left coronary artery, right coronary artery, and left ascending descending artery. So there are majorly three different types of arteries in the heart: the left anterior descending artery, which is known as LED, left circumflex artery, and the left coronary artery, which is arises from that, and the right coronary artery. Then further, as we are going to age, so the clinical viewpoint of the age which affects on heart is that as we advance our aging process, the myocardial hypertrophy take place, which leads to fibrosis of the heart muscles, and lastly the dilation. Okay, so here we are seeing that on a molecular point of view, first there is a degeneration of elastic fibers and also increases of the collagen. This leads to fibrosis of the heart, then increasing clustering and hypertrophy of smooth muscles of the cells and cardiomyocytes, which leads to endothelial dysfunctions. This leads to myocardial intestinal fibrosis, calcium deposition, amyloid accumulation, and upregulation of the activin pathway and TRL signaling. Then we are going to see different types of the heart diseases. So I have given the list of the different types of heart diseases. First is the heart failure, congenital heart disease, ischemic heart disease, arrhythmias, hypertensive heart disease, valvular heart disease, cardiomyopathy, pericardial diseases, rheumatological disorders, and tumor of the heart. So one by one on the future study we are going to see, in the future video we are going to see all these different types of heart diseases. So, moving on the ischemic heart disease. So, ischemic heart disease, also known as IHD, is a group of pathophysiological related symptoms resulting from myocardial ischemia, which is an imbalance between the myocardial supply and cardiac demand for oxygenated blood. That is, the oxygenated blood is not traveling to the heart muscles in a sufficient quantity. IHD can present has one or more of the clinical syndromes that it can lead to myocardial infarction where ischemia causes frank cardiac necrosis, where the cell death occurs. Angina pectoris, where ischemia is not severe to cause the myocardial infarction. Here, the chest pain is so prevalent that the patient feels like dying. Chronic IHD with heart failure. If the IHD, that is ischemic heart disease, blockage of the vessels is chronic, then it will lead to heart failure. It will lead to fibrosis. It will lead to degeneration of the cardiac muscles, which leads to dilation of the cardiac muscles and also leads to heart failure. Then it can also cause sudden cardiac arrest or cardiac death. In more than 90% cases, the myocardial ischemia results blood flow due to obstructive atherosclerotic lesion in epicardial coronary arteries. Thus, the IHD generally refers to as coronary artery disease. So, basically, the coronary artery disease is divided into two types, that is, stable ischemic heart disease or acute coronary syndromes. In acute coronary syndromes, we may see the ST elevation in the ECG graph or no ST elevation with troponin positive, which may confirm that the patient would have been gone through myocardial infarction, and there is unstable angina with no ST elevation, troponin negative. Here, only the pain occurs in the chest region. So, below are the different diagrammatical representation of the ECG. Further, the epidemiology of the cardio coronary artery disease or IHD. The IHD is the leading cause of death in the United States. That is, one of every six deaths, which was reported in 2008, more than 4 lakh individuals have died, and other developed nation approximately 7 million total per year. As high as these numbers, they represent a substantial improvement relative to one of two generations ago. Since peaking in 1963, the overall death rate from IHD has fallen in the United States by approximately 50% due to development of the various types of machineries and also interpretation of the ECG and other tests like troponin test, a trop I test, trop T test, and also 2D echo. Prevention. Additionally, risk reduction and prevention potentially be achieved by maintenance of normal blood glucose level in diabetic patient. Cause in diabetic patient, if he is suffering from angina, then also he may know he may not show the symptoms of angina, that is the chest pain or profuse sweating, because the diabetes mask that reaction. Diagnostic and therapeutic advances also help to diagnose the heart disease and also treat it. Then the pathogenesis. How does the IHD develop in individual? The dominant cause of IHD syndrome is insufficient coronary perfusion related to myocardial demand. Here, the oxygenated blood is not traveling to the heart muscles as it is demanding. Progressive atherosclerotic narrowing of the epicardial coronary arteries due to the atherosclerosis, that is deposition of the fat in the arteries. Here we can see that is the artery is blocked. The arteries can be 60 to 70% blocked, can be of totally blocked artery, which may lead to thrombosis and vasospasm. Then, this is the diagrammatic representation or the pathogenesis of the IHD. Here we can see that increased availability of the lipid that deposits in the arterial wall. That is, the lipid is deposit on the coronary arteries wall because of the involvement of low density lipid consumption in an individual. Compromising of epithelial cells varial, that is degeneration of the endothelial cells, which leads to infiltration by the low density lipids and cell of the immune system. This leads to atherosclerosis. What is atherosclerosis? Atherosclerosis is arterial wall degeneration characterized by fat deposition in and fibrosis of the inner layer of the arteries. It occurs in the coronary arteries. So, if the erythematous plaque is stable, this atherosclerosis plaque is known as erythematous plaque. If it is stable, the fibromuscular cap overlining the fatty plaque contents remains intact and plaque contents are not released in the vessel lumen. ठीक है? Then plaque serve as a fixed luminal obstruction to blood flow. In vessel stenosis, that is approximately 70%, myocardial oxygen demands starts to exceed supply and especially with exertion. So it leads to stable angina. It is predictable myocardial infection. That is, we can predict the myocardial infection in such patient. But if the erythematous plaque is unstable, the fibromuscular cavil over fatty plaque ruptures. Thrombogenic plaque contents are exposed to coagulating fracture in the vessel lumen, activation of the platelets, and the clotting cascades at the site of rupture. Thrombus forms over already partially occlusive plaques, occludes the lumen, decrease the perfusion of myocardium. This leads to transient ischemia of the cardiocytes or the infarction of the cardiocytes. If it is leading transient ischemia, it will lead to unstable angina. If it leading to infarction, it will cause myocardial infarction or complete death of the tissue. This is related to acute coronary syndrome. Then, what are the symptoms and what are the treatment that can be given? So, if the patient having the ischemic heart disease, he may experience extreme fatigueness if he is doing certain work, like or already normal work can also leads to fatigueness of that person. He will have continuous cough and congestion in the chest. He will develop insomnia, that is restless night, weight gain, dizziness, increased sweating, profusely sweating, heart palpitation can be seen, chest pain and pressure, shortness of breath, that is dyspnea, can be felt in that patient. Treatment. What are the treatment? Medical examination. First of all, the basic. If we are examining the patient and we are detecting the IHD in early stages, we can prevent it very rapidly. And enhanced medications which are available nowadays. So, if a person is developing IHD, we may tell him not to smoke if he is smoking. Avoid fried food, avoid heavy foods, always take light food, and indulge in some light physical activity. Consult your cardiologist if you experience the symptoms. Be careful with your health. So, there are 7 different factors which leads to ischemic heart disease, that is with high blood pressure, high cholesterol content in the food, diabetes, obesity, smoking. These all are the factors, risky factors which develops the ischemic heart diseases. So we have to eliminate these factors. Then what are the strategies? What are the strategies of the ischemic heart disease? That is, first of all, maintain a healthy diet plan. Always do regular exercise. Do not smoke. Avoid lipid dense food which controls the cholesterol. Avoid anger. Regular medical checkups should be done. Then are certain diagnostic tests which can perform on the patient. First is the ECG, the basic test for any heart patient or any hypertensive patient should be done. ECG is must for all different kinds of patient. Then there is stress test, which monitoring the heart activity during physical exertion. Remember, if the person is having more than 70 to 90% of coronary artery block, he should not advise the stress test. because he may lead to a myocardial infarction. Then there is 2D echo, that is echocardiogram can be done, ultrasound can be done for the heart muscles. Then coronary angiography, if the person is having 2-degree block or 3-degree block, then coronary angiography is invasive procedure that visualize the coronary arteries to identify blocks and narrowing, providing the crucial information for diagnosing the ischemic heart diseases. So these are all the tests should be done for the patient. If the patient come in the clinic and he is profusely sweating, then first of all we have to do the ECG. Then for the confirmatory test we have to do trop I or trop T test. Then a 2D echo can also be done for that patient for the confirmatory test. Thank you and have a nice day. Please do subscribe my channels and also do share it. Thank you.